Hey everyone, and welcome back to the miniVHAN podcast, where we hit the road to improve health for today and strengthen communities for tomorrow. I'm your host, Mallory Yoder, at the wheel. Today's episode is about resilience, prevention, and the power of showing up for your health. Our guest today is Jo Wiggins. What started as a routine age-based cancer screening led to a life-changing diagnosis, stage 4 colorectal cancer. That screening, something many people delay or avoid, may have saved her life. During radiation and chemotherapy, Jo made an extraordinary decision. She set out to complete a half marathon in all 50 states. Yes, all 50. And her journey is about more than running. It's about advocacy and early detection. Today, Jo is sharing her story to encourage each of us to take preventive care seriously and to remind us that resilience can take many forms. Jo, thank you so much for being here.
It's great to be here. Thanks for having me.
Can you start off our conversation just by introducing yourself?
Jo Wiggins. I'm married. I have 3 awesome semi-adult kids, I guess you call them, when they're in college and college grad. And I've lived here in Nashville 30 years. I started out as public accounting and finance. Now I work for the city, and I love it.
Well, I love that you're here. Being in Nashville for 30 years, that's a lot. You've seen a lot of change. And we've had the opportunity over the last few months to talk about really your passion and your advocacy for preventive cancer screenings. And so I thought we could go back to what it was like when you went in for the routine colorectal cancer screening. What was going through your mind at that time?
So for the colonoscopy, the prep is not fun. Yeah. I have a great group of friends. I have to confess, we share a lot, maybe a little too much. And so when someone's going through like, hey, I'm doing my prep, so I actually had 2 different text strings of friends, big group text strings that knew I was doing it. And it was just kind of lighthearted and, no concern. I was healthy, I was active, I eat well. So there wasn't any trepidation going in.
And when you go in for this screening, you're having the conversations with your friends, which I think is so wonderful. The community part is great. We know the prep isn't fun. Let's make it lighthearted. What were you feeling when you heard stage 4?
Well, it was just really strange. You wake up and I'm sure you're still a little bit groggy. Yeah. And then they, take you back into the room and, and the doctor presents that we think it's cancer, and you're just kind of sitting there looking at the pictures and listening, and you're like, yep, that looks like cancer. And I guess there was a bit of a numbness to it. It wasn't a real dramatic shock or, any big reaction. I just kind of thought to myself, okay, well, let's figure this one out.
Well, and looking back on that time, how do you view screenings now? What might have happened if you had delayed that procedure?
Well, for sure, it's scary to think. One of the things that you learn about, colorectal cancer, it's not a fast, usually aggressive growing. So you think, my gosh, how long did I have this? I mean, I think that was probably one of my thoughts. And of course, the day of the colonoscopy, I did know that I had cancer. I mean, they don't tell you for sure until pathology, but it wasn't until later that you start to learn what stage and how bad and metastasis. But even just in that moment, you think, how could I not know that this was going on? How could I feel so good and not know that this was going on? Which just screams the importance of screening. You don't go just when you think there's a problem. Although I have now learned how many people have symptoms and don't go, which is terrifying to me. And it actually makes me a little bit mad. Yeah. I'm like, I didn't get a chance to go sooner because of a symptom. I didn't have symptoms. So when I hear of people who have symptoms and they're afraid to go, it kind of makes me mad. But also for anybody, just keep up with those screenings because you don't know what's lurking.
You phrased that so well. When you're not having symptoms, honestly, it's hard to think, well, why do I need to go to the doctor? Why do I need to have this screening? Especially when we're thinking about a colonoscopy. That prep is uncomfortable. You've got to take time off work, find someone to drive you, have that recovery. And so for people who are avoiding screenings, especially thinking, I'm nervous about what I'm going to hear or it's not convenient, what would you gently say to them?
Well, I tell people the importance of the screening for two reasons. One, it's not likely. I mean, most of them are going to come out just fine. You're going to get a clean bill of health, nothing to worry about. Like, it's just check that box and have that peace of mind. So I don't want people to be scared about going because mine ended up with a cancer diagnosis. That's not the norm. It's so go and just check that box and be done and have that peace of mind. But also with your colonoscopy, the reason that screening is so important, it's one of the screenings that can actually prevent cancer. So if you go in and you do have some precancerous polyps, they remove them, and then you're going to come back sooner because you had it, and you are never going to get cancer.
That's amazing.
Yeah, I mean, a mammogram can't get rid of, precancerous cells. Other screenings can tell you there's an indication of cancer. This can actually prevent you from getting cancer. Why wouldn't you want to do that?
That's huge. And, to your point, that's not something I think that's commonly known.
Right.
To know that it's not just screening to look for something, it really is prevention.
Yes. And how often do you get to actually say, I'm preventing getting a cancer?
I mean, that's huge.
Yeah.
And I do, I have more questions around that, but I want to talk a little bit, if you're comfortable, around treatment, because you're such a remarkably resilient person, and your passion for advocacy is so inspiring, despite all that you've gone through. So can you talk a little bit about what it was like going through radiation, going through chemotherapy, while trying to be a mother, be a wife, be an employee? What was that like?
I think the more I had everything stay normal, it just felt okay. It was manageable. I mean, I was able to say, well, these are the days I'm going to go. I mean, I do remember so clearly that first drip of chemo and looking at the bag and, and thinking like, am I going to suddenly feel different? And you don't. I mean, I always say infusion days, there's really nothing that hurts. I get jabbed a little extra, but you don't feel sick the moment that chemo hits you. But you don't know. I mean, most of us have this idea of chemo is really awful, and it's all different. Everybody's, kind of mixture, everybody's chemo cocktail is different. So you just don't know what to expect. And so I guess I just didn't want to expect the worst. And maybe that's the difference, is if you just say, well, I don't have to talk myself into, or don't let my mind think that I feel worse than I do, just because it sounds awful. So, chemo just kind of became a routine where I knew what day I would feel okay, and I might be extra fatigued this day, but I'd be fine by Monday coming around back to go to work. And there it was.
Is that hard to balance to, okay, I feel okay going to work, and there may be people that visibly I'm not presenting with something that I'm internally feeling very challenged by. Is that a hard thing to balance?
For the most part, I like the normalcy. So I didn't necessarily want any extra attention or anybody to feel bad for me, or, I didn't need any extra slack or anything like that. But every now and then there is a part of you that if you're running a little bit behind or you don't feel great, you're like, okay, give me a break. I am hooked up to chemo.
Right.
Like, I literally have my fanny pack on. And I do. I go to the office. I have sat at Metro Council meetings on Tuesday nights, late into the night, hooked up to chemo. And, it's in my little fanny pack. And I'm always like, this is not a fashion statement. This is a medical, device. But there's also just getting through it, I think, subconsciously gives you strength. So if you start to realize, I really can do this, I really am okay, you just keep pushing forward and doing what I want to do. I think that's the biggest thing that I've tried to just keep living as normal as I can.
And your story is incredible. You are incredible. Spoiler alert for anyone, but she's did a marathon in every state and just completed 50. So yeah. I think that is incredible.
Half marathon. I do have to clarify.
Half
I've
marathon.
done both, and they're very different.
Well, I've not done either, so I think that's remarkable. So can you walk us through that decision? Were you running before treatment and said, okay, I want to continue on. This is part of my normalcy and my journey and my identity. But what was that turning point of, I'm going to finish this goal?
Yeah, so it was my dear friend Lisa threw out the idea back in 2016 that we had at that point done a half marathon in 6 states. Apparently that was the tipping point. She said, hey, 6, let's do all 50.
Oh, yeah.
Okay.
That's a big range for
right?
6. I love it. Yeah.
So we did. And we just kind of started slowly, and then we were doing maybe 4 or 5 a year. And then, so we were at 23 states complete when I had my diagnosis. Mm. And we were registered for Tulsa, Oklahoma, state 24, 2 weeks after my diagnosis. So I had not had any treatment yet. I had not had my port, put in yet. So physically, nothing was different. So I kind of thought about it. I thought, am I really going to be able to finish this? I don't know what treatment looks like. I don't know how sick I'm going to get. I don't know how I'm going to feel physically. Can I actually finish this? Because I could go ahead and do this, Tulsa, that makes it state 24, but there's really nothing exciting about having done 24 states. It's like it's all or nothing. And so I thought, well, it'd be perfectly fine to just shelf that. And I thought, but I'm not really any physically different. Like whatever cancer's in me has been there at least a while. And you've done all the other states. So just go ahead. And we always have so much fun. We call them runcations. And
runcations?
Yes.
I love that.
Some people might not think that's fun, but we mostly just love seeing the cities. We try to be tourists and do as much as we can. And in this case, our husbands were coming with us. So it was, the 4 of us went off and had a great time in Tulsa, and we ran the race together, and it was great. And a week later, I started treatment, and we had already registered for New Orleans the first week of February. And so, again, it was like the trip was planned. We were registered. It was an off weekend. So I've typically done my chemo on Thursdays, which means I'm hooked up for 46 hours until Saturday, and then kind of puny that weekend. And then I'm fine and go on the rest, go on my merry way. So as long as we figured out that we could do races on the quote unquote good weekend. Okay. So on the one that I wasn't having treatment. And that's how that race fell. So I said, let's try it. And I got out there and we kind of jogged the whole thing slowly. And I realized I could do it, even in between chemo treatments. So I said, let's just keep going. Let's do this.
That's amazing. With Lisa by your side.
Yes.
We love a good cheerleader. That makes all the difference. What did running represent for you in the midst of cancer? Because I know not every race was the same.
Oh no, we had a little debacle after after radiation, but in general, it was motivation to stay healthy and keep exercising. I can't say that after surgeries, that changed the game a little bit. That's when I coined the phrase wogging. We walk and jog.
Wogging. Okay. I love that.
I had some really major surgeries that, kind of sidelined me for about 6 months, and they were harder to come back from energy and I couldn't run the whole half marathon anymore. But I thought, if you don't mind, and Lisa was such a good sport. I mean, she could smoke me. She could have just finished, an hour before I did and sat there and
your champion.
Waited. But she was by my side, and she said, I'll do whatever you want to do, whatever it takes. And so we would just jog, the race, walk.
Yes.
And that just gave a sense, again, I kind of go back to this sense of normalcy, that's what we were already doing. And so we're going to keep doing it. We're not going to change course because of cancer. Like, cancer's not going to stop our plan. It also is, like I said, motivation to stay healthy, keep active, and also to feel, that I was accomplishing something. I think subconsciously that motivated me. I've had so many people very graciously say, you motivate me, you inspire me, but it's really a little bit about not wanting to let anybody else down is also really good. Other people inspire me to keep being my best version.
Well, and you've mentioned so many important points. There may be somebody listening who's going through a similar journey, and they may say, I can't run a marathon, or maybe that's not, maybe they're not a wogger.
Yeah.
I know I'm not. But I think what I'm hearing are so many important messages of how can someone kind of find their strength and find their identity through this. You're mentioning themes of normalcy and inspiration and holding on to some of those things that make you you. And I'm curious, for somebody, let's say you're talking to yourself a few years ago, what would be a piece of advice that you would share with Mary Jo,
Yeah, I think the biggest thing that I try to tell others, and I love being connected to other folks that are maybe just starting, this journey with cancer, is to say, don't put things aside and have the mindset of, well, when this is over, I'm going to get back to, fill in the blank, the things that, that you really love. Or, cancer is a thief. It can steal your time. It can steal, your health and things, but don't let it take things. Take them back. I didn't sideline the things that I wanted to do. If I learned early on, better to say yes. Hey, do you want to go out Friday night? Oh, I'm going to be hooked up to chemo. I don't know if I'm going to feel good, but let's say yes. Last minute, if I have to cancel,
that's okay.
No one's going to, be mad at me about that. But it kept a plan. It kept doing something that I wanted to do. And I think because of that, I never felt probably as bad as I should have.
Wait, I love that. And you were giving yourself something to look forward to.
Yeah.
Normalcy and runcations and
and you're going out to a movie with friends and you say, well, I don't know if I'm going to feel great. Well, okay, but you might feel great. So don't not do something on the chance you might not feel great. Just plan on feeling good. And you just might. And I feel like that is what happened. I was like, oh, I kind of got through this round. I did this, and this, and I still did, chemo on the side.
You get your joy. I love, saying that cancer is the thief. You're creating the circumstances where your joy is not being stolen.
Right.
Who you are isn't being compromised.
Right. Exactly.
By something that is very challenging. And I want to go back to the race because I'm curious, is there a specific one that stands out to you as exceptionally meaningful or fun or inspiring of all the 50?
Now that we've finished them all, Napa this past March 1st was our 50th, and it was incredible.
What was it like?
Pretty epic.
Crossing the finish line.
Lisa and I looked at each other like, don't ugly cry, don't do it, don't do it. But, when you're back of the pack, so the crowd had thinned. Most of the folks that were really finishing quickly, were gone. And so our crew, and when I say our crew, there were over 70 people, probably close to 80 people at the finish line. And
wow, with your crew, 80 people?
Well, there were probably about 12 to 15 of us running as a pack. And there were some other people doing the full marathon, so they weren't there. But as far as like spectators, there were probably close to 70, 60, 70 people. And because it was kind of at the end, they could all get front and center on the, on the race course. And we came in and just were able to kind of, high five everybody through, and then you kind of go down the chute. And, there were times that I dreamed of finishing. So it was everything I dreamed of.
That's beautiful.
Yeah, it was just so much fun. And for me, what was really special was it was groups of friends from high school. I mean, when I say high school, some of these girls I went to grade school with, and, you know, and people I met 30 years ago when I came to Nashville, and there was family, and there was like my running crew friends. Like it was, this is your life. It was a little bit of all these different circles of friends and family came together. And it was great.
That's so beautiful.
And I'm going to cry.
Well, me too.
Sorry.
No. I what an incredible, not just accomplishment. I don't even know the right word. I mean, what a beautiful moment. And having all of these people in your life there to celebrate you.
Yeah.
I mean,
the love and support was just amazing.
And you're so deserving.
Well, thank you.
You are. And to have that as an inspiration for other people of, you know, saying yes to whatever that may be. And I think the other thing is it's hard sometimes for us to accept help and support as humans. We're like, oh, everyone is busy. You have your own life. But I think your story reminds me that people really do want to help. They want to show up. They want to support. Let them do that, you know. That's
a gift. Really key, you know, component. If you think about it, when you have somebody that you love and want to help, you just want to do something to help. So
yes,
let somebody do that, because that actually makes them feel good. And it actually is helpful, you know, to have a meal, you know, at home, you know. And think of it too, I thought of it a lot, not just for me, but for my husband and for my kids, because they end up having to carry a lot of load that I probably don't really understand, you know, what it's like to be in those shoes. And so, you know, just for them to not have to cook, just for them to not have to do the dishes, you know, something simple as subconsciously think about your caregiver also and what they're going through. It's hard because you don't know exactly.
Yeah.
But so there were times when people say, can I drop something off? And no, we don't need it. You know what? Yes. Thank you.
It's hard to say yes, but I love that you're sharing the benefit not only to you and your health and journey, but your family and your caregivers. And because it can be a lot, and everyone wants to share in this together. And I'm sure that through this, you've probably found new ways that you are helping others going through a similar experience.
Oh, it's really fun to be able to give back in whatever form or fashion. A little odd kind of side stories. I really kind of got into flowers and doing little arrangements. And so I have Thursdays off of work every other Thursday because it's at Vandy for chemo, but that means every other Thursday is really my day. And so lots of times I like to do little floral arrangements and drop it off to somebody that has, you know, done something for me or inspired me or just touched me in some way. And so that's kind of become my little thing.
A Mary Jo Day.
Yeah.
Flower arrangement. I love that. And I do want to ask a little, I know you're continuing with treatments, right?
Yep.
You're still at Vanderbilt.
Mm-hmm.
What's that like? Because you're there often.
Mm-hmm.
Do you start to form a relationship with your care team? Is it, you know?
Absolutely.
We're telling inside jokes and stories at this point. What's that experience like?
I mean, when the valets no longer ask your name.
Okay.
You know, you've been there a lot. But again, thank you, Vanderbilt, for valets.
Yes.
So I have, for 4 years, I have had chemo every 2 weeks, with the exception of about a 10-month period. And of course, with in between surgeries, you don't have it. So I say this all the time. I stopped counting. I mean, I think I'm roughly around 80 rounds of chemo. So I do get to see the same nurses, you know, in the lab, you know, and then I have, you know, my oncologist and nurses, you know, as part of my team, you know, my surgeons, and then infusion. And so when I go up to infusion and I see the same nurses, and they know that, I think probably most people do know me as, hey, what state are you on? You know, which one did you do last weekend? And so that's just been fun, you know, because it's also something enjoyable to talk about.
Right.
It's something that I think gives other people something to ask me about versus just how are you feeling? Are you sick? You know, where's the pain? All of that. it's just nice to be able to have something that's fun for everybody to talk about. And there's a bunch of the nurses that are runners, so they'll talk
That's
about
what I was thinking,
where have you
yes.
gone? What race should I do in this state? I was thinking about doing this one. So
Bringing it back to the human that we are,
Yeah.
This is Mary Jo. She does flower arrangements and runs these marathons.
Yeah.
It is an incredible person, and I think that's so important.
But they're so caring, and you kind of want to be in their shoes. You think, well, gosh, they work in this environment where everybody has cancer, but it's not a sad place. It's really it's a place of relationship, and they're there to take care of you, and they care for you, and they're smart and they're knowledgeable. But I've been very fortunate. I do go in healthy. I don't really have a lot of. It's ironic. I'm probably the healthiest sick person, but it's easy. It's not. I always say infusion days aren't dreadful. I go in. I get to see familiar faces, chit chat. Nothing really hurts.
I'm grateful that is the environment, and I'm continuously inspired throughout our conversation because just you speaking of your health going into the experience. That's it's just incredible.
One thing that I think is interesting, I've had folks that have said, gosh, you were healthy, you ate right, you exercised, and you still got cancer. Like, that's not fair. Like, why should I take care of myself? And I did have one of my nurses say, because you took care of yourself, you're getting through this. If you weren't healthy, it wasn't that you did all those things. You can't always prevent cancer, but you did all those things because now you can get through it. And so it's not a waste of time or
That's
a waste
remarkable.
of energy or effort to have been your very best.
I had
Not
not.
that I was my best.
You are, but I had never thought about it.
Yeah.
That's true. You've taken such good care of yourself mentally, physically, socially, so that you were more prepared to
get through this battle.
Yeah.
Yeah. So it's,
Wow.
nothing's for naught, right? I mean, there was value and meaning in all of that. So I think people should continue to take the very best care of themselves, do the best that they can as far as diet and exercise so that when you're faced with something, you're able to get through it.
And it's never too late to start those things.
Right.
And we can probably look within, because sometimes it's hard, oh my gosh, where do I even start? And we need to find us a Lisa.
Yeah.
And go for, a fun little walk. Yeah.
Walking is really, and I always say to folks, you don't have to add the jog portion. Just go for a walk. And there's all sorts of studies.
It's cathartic because it's
how
also
good it is. And walking with a friend,
Yes.
it's social. We never ran fast enough that we couldn't chit chat the whole time.
Yeah.
So
Now, are we taking international? What happens after 50 states?
we get that a lot.
Okay.
We say we will just travel without our running shoes.
Got it.
Yes.
Okay.
So we don't have to pack all the accessories and things that have to go with running, but we will still continue to travel.
Oh, I love that. I love that so much. Let me ask, you're such a strong advocate for cancer screenings. Even when we were talking about this particular podcast, I know that you were very passionate about, what you were saying earlier is get screened. What do you think drives that passion now? And what was it like? What's the difference between when you first walked in to the colonoscopy as a routine screening compared to how your thought process is now?
I think for folks not knowing or not thinking they need it, I just want to be that reminder that it's so important. It's the same. I mean, we all go get our mammograms. I mean, we should. I do. And sometimes even I think, do I really have to go get a mammogram? Because I'm getting, CTs and PET scans. Like, won't that pick it up? Like, should I really keep? And the answer is yes. Keep up with all your screenings, your physical. My husband ended up with prostate cancer. In the 10 months that I wasn't going through treatment, my husband had cancer. I mean, our poor kids are like, is our family falling apart? But again, if he didn't go for his annual physical, showed an elevated, PSA,
Yes.
then so guys, go get your screenings. Again, prostate cancer isn't something that has to be, fatal, but if you don't catch it soon enough, you're going to have complications. So there's just a lot of screenings, and we need to pay attention to our health. They don't have to be scary. No. I mean, they can just be very simple. I mean, I think the colonoscopy is the one that probably bothers people the most because of the prep.
Right.
But it is the best nap you'll ever have.
See, a positive. And during the prep, you can watch something you like,
Right? I mean, it's an excuse to stay home and binge TV.
Yes.
But keep up with the screenings because they really will make a difference. A lot, treatments are so much better. And really, even in the 4 years that I've been going through treatment, there's new findings. There's new, chemo, there's immunotherapies. Like, things keep coming out to where the sooner you catch it, the easier your path will be.
And we've had some conversations around even cancer screenings evolving, some of those experiences becoming a little easier, more accessible, even for colorectal cancer screenings where there are, maybe first, second lines of defense that you can go through. So there's continued work there. And for folks that do have a primary care physician, that's often a good primary source of, here are the screenings recommended for you based on your family history or your age, but there are also other resources and public health initiatives where I think I'll see billboards that are promoting screenings, and you're thinking, wow, this is so important,
And tell your friends that you're going to get screened.
Yes.
I mean, I think the other thing is talk about it, because if you say, even if it's not in a positive light, at least if you're doing it, I always say, if you're doing it, you don't have to love it. You just have to do it.
Yes.
So, I'm going to get my mammogram today. Oh, I'm going to get my pap smear today. I have my colonoscopy today. If you're willing to talk about it, you might actually convince, your coworker sitting next to you to go do it. You might convince your neighbor, your friend, whoever you're talking to. So I like to talk, obviously. I'm a chatterbug.
Same.
But if you share those things in very casual ways, you don't know that you might it might trigger somebody, I meant to, I forgot to schedule.
Yeah.
I didn't get my colonoscopy until 51 because it was COVID. I was perfectly healthy. They didn't want me hanging around there and getting in the way of, sick people or taking somebody's spot that needed it and whatnot. And so when it was I always tend to do a lot of my annual physical and doctor appointments around my birthday. I just feel like that's how I'll always remember. And so it was my birthday. I was almost 51. I was like, I better schedule my colonoscopy. But it's now 45.
Right.
So I was right at that edge of folks that it had been age 50. It's age 45. Just do it.
You're talking about sharing with friends, and that really makes me think about my mom. She is always advocating to her friends about screenings, and she retired recently, but prior to that worked in an elementary school with predominantly women. And she was gone one afternoon. Oh, where were you? Oh, I went to get my mammogram. Oh, and someone was like, oh gosh, I haven't done it. It's not comfortable. And she said, look, I know it's not. Go. Afterwards, get you a coffee treat or a sweet treat or,
That's a good way to do a little reward.
Just a little, like, I did this. And she said, you do it for you and the people that you love.
Yes.
And I know it's not comfortable, but just go. And I think that's the message from you. And the other thing, too, that you pointed out, you may not have symptoms, so those screenings are so important. If you have something that you're physically experiencing that does not feel normal for your body, go seek care. It is so much better to go and find out, oh, it wasn't something that can't be addressed. That's great. But know that you're in tune with your body and listen to that.
And keep listening. In my situation, it was all obvious once I was there. But you do hear stories about people who have had to persist. And some of it is, I'm at the age where a lot of my friends were going through menopause.
Yeah.
And so people say, oh, well, your bowels will be different because of menopause. You might be experiencing this because of menopause. And so there's different ways to kind of, and not hide it, but, kind of placate and push it aside as oh, that's okay. With colorectal cancer, lots of times somebody may say, well, it could just be hemorrhoids. Well, nobody wants to talk about hemorrhoids. So they don't, so they don't talk about it, and they just accept that as the answer instead of really pursuing just get the colonoscopy, people. I mean, it just, so many things can be answered. I don't know why that's not considered like a first line of attack, when there's so many different questions that people are having as far as symptoms.
To rule that out,
Keep pushing for that, for the answers, just because the first one might feel, again, nobody's doing you a disservice, but that might be the most common answer, so they just kind of give that and take it instead of really pursuing. If you know something's not right,
advocate for yourself. Absolutely. And for people that are listening today, what is the one thing you would like for them to take away from your story, your journey?
I think that we all are going to be presented with challenges. And I think one of the things that I've experienced is sometimes, people kind of need to vent or, kind of complain about something that's happening to them. And sometimes if I'm in the room, they'll say, oh, sorry, like I shouldn't be complaining. And I always try to say, no, everyone's kind of entitled to their own, everybody can have their own pity party. I mean, it might be something at work, it might be health, it might be, your children are struggling, we all have a little bit of a cross to bear at times.
Yes.
And I think that everybody, deserves the chance to kind of feel their own, annoyance or pain or grief or whatever that is, but to also keep perspective that is only one small piece of what's happening in your life. Make sure you're paying attention to all the other good things, because there are so many good things going on. There are so many good people that are coming in and out of your life. And, and for me, that is very much my faith. And I know I wouldn't get through it without my faith. And there was never a moment of why me. It was always, well, I mean, why not me? I mean, I look around, nobody deserves this. So is there somebody I think should have had cancer instead of me? I mean, absolutely not. So if I can still find all the joy in life and do almost everything, and I can't do everything, but everything that I really wanted to do, keep doing that. So whether it's something really big like stage 4 cancer, or whether it's something that's really just in your craw that day, keep perspective. It's okay to acknowledge it. It's okay to, kind of fuss about it, but always keep perspective of all the good that is there, and just focus on that.
All the good.
Yeah.
And that could be your 50th state marathon or going to the movies with your friends.
It can be really small.
Yes, because those moments are so important.
Yeah. And just have fun with it and share that joy, because there might be somebody who's also in that moment of, frustration or hurt or grief, depending on the scale of what's going on, and just sharing a little bit of joy with that person can maybe turn them and, in their focus and start them on a path of seeing the good.
You start that flywheel of positivity and inspiration, and you have been that for us today. And is there anything else you would want our listeners to walk away having heard or, learned from you?
Well, definitely find something that gives you joy, right? Multiple things. I always say, do go see our lovely, beautiful world, especially our 50 states. I've been to them all. I can tell you what, all the good stuff. But find something that brings you joy. Keep your faith. God is good all the time. And find your friends, your community, your support, and, they'll be there for you and you will be there for them. And that's also gives that joy.
Well said. So Mary Jo, I know you have a wonderful catchphrase when it comes to screenings. Can you share that with us?
Yeah, if I'm allowed to say.
You are.
Okay. I always say, make sure you're getting your boobies, your coochies, and your booties checked.
I love it. You know what? That's a good way to remember it. And that's
all of them.
That's our new bumper sticker.
I like it. I'd put it on my car.
I know. Love it. Do you have a favorite state that you visited?
We like to say top 5.
Top 5.
It's really
I mean,
hard.
yeah, that would be hard.
So Jackson Hole was just beautiful and
I would
amazing
love
with the
to go.
Tetons, and Bozeman. We had beautiful mountain views. Bend, Oregon was really beautiful, and we ran through neighborhoods
Yes.
and greenway trails. Charleston did a great job on their course.
Okay.
Because
Beautiful
it went
down
through
there.
all the tourist areas, and Vermont was lovely, covered bridges and beautiful scenery. So
Vermont is on my bucket list to
Yeah.
go visit.
it was really pretty. So they were all, they all kind of had a special moment.
Yeah.
But we kind of say those were really well done races, either fun crowd support, beautiful scenery, good course.
Wow. I love
Yeah.
that. Well, congratulations on
Thank
the
you.
50 states, 50 marathons. That's sensational. And I'm going to continue to think about you and your journey and to continue being inspired so that we can get our screenings and, most importantly, find that joy and find that from that joy from within so that we can also give that light back out to others.
Yes,
I think that is so important.
I agree.
Thank you, Mary Jo. This has been beautiful. You're wonderful, and I really, really appreciate you sharing your story. We talk so much about cancer screening and prevention, but to hear directly from someone such as you that has been going through something for several years and is such an advocate for something that is not only important, but we all deserve that. We all deserve to live a high quality, healthy life as best as possible.
Yeah.
And I
thank you
appreciate
for letting me share the story, and I love what you said too. Do it for your families.
do it for your families.
Yeah.
Yeah. Thank you, Mary Jo, for joining us in the minivan.
Thanks.
It's been a great ride.
I appreciate it.
As we wrap up today's conversation, Mary Jo's story is a powerful reminder that preventive care matters. A routine screening can change and even save a life. So, if you're due for a screening or if someone in your life has been putting it off, let this be your nudge to have that conversation. Early detection isn't just a medical recommendation, it's an opportunity to take control of your health. And if you enjoyed the information in our episode today, visit our website at minivanpodcast.com for more information, tools, and additional episodes. Thank you for listening. We'll see you in the van next time.